talking about everything as a whole, the entire hospital systems, insurance companies, and everything that kind of goes along with it. So, healthcare is one of the largest and fastest growing industries in the entire United States. When we talked about in chapter one how the elderly population is getting older and requiring more healthcare, we're using a lot more preventative care, which is why healthcare is growing a little bit. So these statistics down here on the PowerPoint are a little bit dated since we're already in 2021, but it kind of gives you an idea about how many workers there are in the healthcare industry. So right now, because we are in 2021, there's over 22.1 million workers employed in healthcare. That's a lot of people working for the healthcare systems in one way or the other. So, healthcare facilities can attract a wide variety of people from all different types of backgrounds because there's so many different career options. When you think about, different healthcare experiences and all the people that take care of you, from the housekeepers, the grounds crew, dietary, um, LPNs, nurses, doctors, diagnostic imaging, everywhere you go in the hospital, your care is going to be met by many different individuals. Even the registration clerks who are admitting you and getting your information, the people that are meeting you at the front desk to tell you where to go. So that's the nice thing about healthcare facilities is you don't have to have a degree. If you have an interest in healthcare, you can work in that setting without necessarily having a degree. Now, the amount of money you work and the things that you want to do, some of them are going to require one. Um, Along with the healthcare comes spending, right? We talked about that a little bit before too. Healthcare spending was over $2.9 trillion. And obviously, again, this data is a little bit dated, but in 2020, healthcare spending was $4.6 trillion. That amount of money is sometimes even hard to just fathom or understand how much we're truly spending. So that's why when we talked about cost containment, in the past chapter, that's very important because of the amount of money that's being spent. We need to try to control that rising cost because it's affecting everything. It's affecting the patients and how much they're paying, and insurance companies, everything. There's a lot of different types of hospitals out there. Hospitals are just one of the major types of healthcare facilities. There can be many different types of facilities out there. So, hospitals will vary in size and types of service that are provided. So, I know not all of you are from Jackson, Michigan, where Jackson College is, but if you are from around here, you'll know there's many different types of hospitals. We've got Henry Ford Allegiance in Jackson, which is a fairly big hospital, but then we have Ann Arbor, U of M, that's quite a bit bigger, as well as St. Joe's in Ann Arbor. And then we've got some small hospitals like Chelsea and Oaklawn and Marshall. And then again, getting a little bit bigger in Sparrow. We've got a lot of outlying ones like Hillsdale, um, places like that, Bixby and Adrian, that tend to be a little bit smaller. And some of those hospitals are going to specialize in types of services as well. So they could be pediatric, they could be oncology, they could be a general hospital. So there's a lot of different types that you will see out there too. And if you're not from Jackson, I apologize, but I'm sure you can think of some of the hospitals around you and the difference in size that they have. Hospitals are classified based on the way that they receive their income. So there's private or propriety hospitals where their money is actually coming from Medicare, Medicaid. It comes from insurance companies, private donations, stockholders, and investors. That's how they get their money. Private or propriety hospitals do not pay taxes. They don't pay federal, state, or local taxes at all. Religious hospitals, they receive their funding from the government, and they also get donations from religious supports for their whatever religion they are. And then they get money from patient fees as well. Nonprofit, not for profit, or voluntary hospitals, they are viewed as a charity. They're not saying they don't make a profit, but it is just kind of classified a little bit differently. Um, they get their money from Medicare, Medicaid, insurances, the government, A lot of times for nonprofit and voluntary, they'll do fundraisers or donations to try to raise money. And again, they do not pay any federal, state, or local taxes. But they have to, they're required because they're a nonprofit to provide certain benefits to the community. So they need to give back as well. And then government hospitals, they receive federal government, and then they get patient fees as well. Like I said, there's a lot of different types of hospitals. There's general hospitals, which most are. They treat a wide range of conditions, all age groups. They don't specialize. And then there's specialty hospitals, which provide care for special conditions or age groups. Government hospitals, which are operated by the federal, state, or local government, and they can provide any care for government employees or their dependents. And then there's also university or college medical centers, which they provide normal hospital services, but they also do a lot of teaching, education, and research. So if you can give some examples of different hospitals, like if you can think of some specialty hospitals, like some that always come to mind for me are St. Jude's. St. Jude's is a specialty hospital. They focus on children. So that's something that is very specialized. Government hospitals, most places have the VA hospitals, the Hospital of Veterans Affairs, that they will take care of any military or service workers. And then there's also university or college medical centers. Like if you're from around here, the University of Michigan U of M Health Center, they're a university medical center that does a lot of teaching. Other types of healthcare facilities are things such as long-term care facilities. You'll see the initials here, LTC or LTCF for long-term care facility. What they do is they provide assistance for elderly patients. A lot of times when we talk about long-term care or assisted living or anything like that, they don't refer to them as patients, they refer to them as residents, which just makes them feel a little bit more comfortable, like they're not in a hospital, that this is their home, they're residing there. It just gives them a little bit more peace of mind, I guess. So, long term care facilities, they provide care for individuals that could either be disabled or handicapped, or just elderly individuals with might have chronic or long term illnesses that can't care for themselves. And there are a lot of different types of these facilities. They can be range from needing full 24-hour care to just maybe needing a little bit of assistance with medicine or meals or housekeeping, things like that. There's residential care facilities, which we used to call nursing homes. We really try to get away from that now and call them residential care facilities. They provide the care to the people who can no longer care for themselves. So that's full-time, 24 hours care where they're living in that. It's similar to a hospital setting. Some of them are different than others. Some of them they have individual rooms, some of them they have to share. There's also extended care or skilled care facilities. They provide care and rehabilitation. They are actually trying to prepare patients to get back to their home or other types of long-term care facilities. So usually those are not long-term situations. You could have an individual who lives on their own normally, but maybe they fell and broke their hip and they don't have anyone to care for them at home. So what they'll do is they'll transition them from the hospital to the extended care or skilled care facility, help them get rehabilitation, and then once that person can take care of themselves, they would go back either to their home or to another long-term care facility if they don't progress. There's also independent living and assisted living facilities. Those are for people who are pretty independent, so they can care for themselves. What they usually do is rent an apartment or even a house. Sometimes there's some pretty nice houses around that these patients can rent, and they'll bring in meals, they'll deliver their medications, they'll clean their house, they'll do laundry. There's all kinds of different tiers that you can enter. Some people actually purchase these homes and then they stay within that system as they need different care. So if they needed rehabilitation, they could go right to that, and then if they needed long-term care, they would go right into that. If you're from around here, there's, or I'm sure wherever you are, there's similar situations, but they have around here, the Gantt facilities, they've got an entire block. And they have a memory care center for people with Alzheimer's. They've got the rehabilitation center. They've got condos and assisted living, and then long-term care facilities. So the residents can move from one facility to the other as needed. And even right on site, they've got a lot of other things. They've got a pharmacy, they've got a hearing aid clinic, they've got a rehabilitation for physical therapy and things like that. So it's all kind of housed in one community where the patients can move around, or residents. It's hard for me to even to do that. But the patients and residents can move around and get the care that they need right within that same facility. Another type of healthcare facility are clinics or satellite centers. Some examples of these would be like urgent cares, walk-in clinics, rehabilitation, substance abuse, or surgery centers. So those are just different types that you would utilize. So a lot of times they have outpatient surgery centers. That way the patient isn't having to go to the hospital. If they don't need to be an inpatient or stay after their surgery, they can go in, get their surgery, have a little recovery time, and then they're on their way, which is actually another form of cost containment. That patient not having to stay in the hospital helps lower the cost of care. And then I'm sure all of you have probably at one time been to an urgent care or small ER clinics that aren't affiliated with the hospital. Those are going to help with little first aid or emergent care for ill or injured patients without having to go to a full emergency room. And then again, the different rehabilitation clinics, they can have physical, occupational, speech, or other types of therapies that they offer to patients. And substance abuse provide rehabilitation for drug and alcohol abuse to patients. Other types are specialty, outpatient, or health department. So specialty clinics can provide care for specific diseases. Like you can have a dialysis center that all they do is perform dialysis for a patient. So those are the only patients that they're seeing. Infusion centers, things like that. There's a lot of different ones out there. Outpatient clinics are usually operated by the hospital, and you can provide any care that the outpatient may needs. And then you've got your health department that's offered in almost every city. They can provide pediatric care. They usually do treatment of STDs or STIs, immunizations. They'll do a lot of education too, and pregnancy prevention, things like that. Another type of healthcare facility is emergency care services. So they're going to provide care for individuals with sudden illnesses or accidents. There's different facilities providing these services, and they can be ambulance services, rescue squads. Rescue squads are usually independently run by the fire department. So they used to be called volunteer. They're not really volunteer anymore because most of those, they're called paid on call now. But most of those are independent individuals that are coming with their own vehicles to assist the fire department. Emergency care clinics, emergency departments, which are operated by hospitals, and you can also have helicopter or airplane services that will quickly get patients the care that they need. I mean, you've all heard of Life Flight, I'm sure, where the helicopters can land right on scene, and a lot of times, and transport the patient right from the scene of an accident to the hospital to get care. They also have airplane emergency services, which aren't really as big of a thing in cities, but in rural areas, they tend to be a little bit more popular. There's actually services where you can hire an airplane. Like if you were on vacation in another country and you were injured and you needed transport back to the United States, you can actually hire an airplane company. It's only like, I don't remember now, like $10,000 or $20,000 only. And what they'll do is they have their own EMTs and they'll come and get you and transport you back to wherever you want to go. Home health care is another form of cost containment, like we talked about in Chapter 1. And home health care became a lot more popular once those DRGs started, those diagnostic related groups, remember, where they put kind of a diagnosis with everything and are only paying a certain amount for each diagnosis. So patients weren't able to just stay in the hospitals indefinitely anymore because they were kind of cut off with funds. So that care started to go back into the patient's home. So that's essentially what home health care is. They're providing care for the patient in their home. A lot of times it's used by patients who are elderly or disabled, maybe patients who just had, again, like I said, a surgery where they can't take care of themselves and need a little bit of assistance. They can provide nursing care, personal care like showers, baths, things like that, therapy. So if you've had, a lot of times they're getting away from recent surgeries, like patients have had recent knee surgeries where they have a new prosthesis, they're sending the therapist right to the patient's home instead of that patient having to come into a rehabilitation center. They'll even clean the house, do food prep, a lot of things like that, take your vitals, whatever's needed by that patient. Home health care a lot of times is offered by the health department, hospitals. There are private agencies that will do it as well, government agencies, volunteer groups, and nonprofits. So there's a lot of different ways to obtain home health care if needed. Hospice is a type of care that we give to patients who are terminally ill and whose life expectancy is 6 months or less. So, if a patient has a diagnosis where they are expected to live for 9 months, that patient can't be on hospice. It has to be 6 months or less. With hospice, the care can either be provided within the patient's home and the hospice nurse can come right there, or they actually do have hospice facilities if there's no one else there in the home to take care of them when the nurse isn't there. So those hospice facilities, they will provide round the clock care. They also do a lot of other things. I hope you've never had to deal with hospice for one of your loved ones. If you have, I'm very sorry, but they do a lot for the families. They give psychological help, social, spiritual. They'll give financial counseling. They provide all that to the patient and the families. And they also provide a lot of support for the families after the patient's passed away. They'll help with a lot of different things there. And they will also provide palliative care. I don't know if you've ever heard the term palliative care before, but it's pretty important as far as healthcare goes, and especially it goes like right along with hospice care a little bit. What palliative care is essentially just care that provides comfort and support for patients that are diagnosed with a serious illness. So the whole goal of palliative care is not treatment at all. They're not giving any forms of treatment. All they are trying to do is improve that patient's quality of life for the patient and the family. So a lot of times that simply means pain management. They're just trying to allow that patient to die with dignity. So again, like I said, they're not going to give any treatment, but there are actually doctors who specialize in that. There are palliative doctors, physicians, that is, their entire practice. I kind of got ahead of myself again. I tend to do that. Sorry. So I already answered that question. What is palliative care? So, like I said, specialized care for medical care with people with serious illness. It focuses on providing that relief from the symptoms and the stress of that serious illness. And again, allows that patient to die with dignity. Another type of healthcare facility is a genetic counseling center. I don't know if any of you have ever had genetic counseling or not, but a lot of these are independent facilities, but they can also be located in a hospital. Sometimes they'll do prenatal screening for couples or individuals who are pregnant or considering pregnancy. So if you have a high risk of genetic defects or sometimes age is a factor. Women over the age of 40 tend to have a higher risk of some genetic disorders with their children. So sometimes they'll check for that. They will actually check for the abnormalities and birth defects. They'll give the results, and then they'll identify any options that patient has up to abortion if there's genetic defects that are serious. Those rehabilitation facilities, like I talked about a little bit, they can be in hospitals, clinics, or private centers. They can provide a lot of different care to patients depending on what their need is, but most of them are for physical or mental disabilities. They're helping them to get the most self-care and function. So they're teaching these people how to help themselves again, and that may be from standing up or grabbing a spoon or teaching them how to cook. There's a lot of different things that they can work on. The therapies can be physical, occupational, recreational, speech, or even hearing. There's a lot of different types of rehabilitation therapies out there. Some of the different government agencies that we deal with, you may not have heard of many of these up until this last year when we've started talking about a lot of the different government agencies and how they relate with COVID. So some of these might be pretty easy for you. But the examples of government agencies that we deal with are the WHO, or the World Health Organization. So they're an international agency that's sponsored by the UN, or the United Nations. And what they do is they take statistics and compile them and information on diseases. They publish a lot of health information, and they investigate and address serious health problems throughout the world. So they're doing a lot of that right now with COVID, trying to monitor this, pile this statistics on all the information that we have going on with COVID right now. I'm sure you've all heard of the FDA, the Food and Drug Administration. They are a federal agency that's responsible for regulating food and drug products sold to the public. So, with healthcare, a lot of the medicines or drugs that we use need to be approved by the FDA. So, you'll hear that sometimes. This medication is not approved by the FDA. So, most medicines must be before they can be administered. The U.S. Department of Health and Human Services, they're a national agency that deals with health problems just in the United States. So the WHO is the World Health Organization that kind of looks over the entire world, where the U.S. Department of Health and Human Services is just looking at the United States. Their goal is to protect the health of all of us Americans. There's also the NIH, which is the National Institute of Health. They're a division of the U.S. Department of Health and Human Services. And what they specialize in is the research on the disease. So they rely on them to research the disease, give the data to the U.S. Department of Health and Human Services so that they can make decisions that way. Another more common one that you've probably heard of is the CDC, the Center for Disease Control and Prevention. So they're another division of the U.S. Department of Health and Human Services here in the United States, and they're concerned with the cause, spread, and control of diseases in the population. So they're actually doing quite a bit right now, trying to help with COVID, tell us what our rules and restrictions are, and how to try to prevent this and quit spreading it here in the United States. Another one that we kind of deal with a lot in all workplaces is OSHA. So OSHA stands for Occupational Safety and Health Administration. What they do is they make up or establish rules or standards that protect employees and workers from getting injured on their job or getting job-related illnesses. They also enforce those standards too. So if there's an injury on the job, OSHA is going to come in and do a little bit of research, do an investigation, try to figure out what happened, and then try to prevent that from happening in the future. So they're looking to see if all these guidelines were followed and met, and where the lapse was and how the incident or injury occurred. So they take on things such as limits on radiation exposure and the use of personal protective equipment. OSHA can be all over. I mean, they're looking not just in healthcare. I mean, they're any job, construction, restaurants, pretty much anywhere you go, you would see standards for OSHA. If it's any occupation, Occupational Safety and Health Administration. We talked about the health departments already. Each health department is ran by the United States Department of Health and Human Services. They provide a lot of specific services, and those are determined by the need in each state or the local community. So some states may provide more care on pregnancy if they have a higher teen pregnancy rate, opioid crisis, and some others. It just depends on what the need is in that state or local community. So again, I said before, their services can be immunizations, inspections for health department and sanitation. So if restaurants, sometimes they'll get inspected by the health department to make sure they're up to the standards. They also keep records related to health. So if you ever needed a record of your immunization, you'd go to the county health department where you were born or where you had your immunizations, and they keep all that on file. They also do a lot of health education, and they have clinics for healthcare and prevention as well. Some other healthcare facilities are voluntary or nonprofit agencies. A lot of those are supported by donations from individuals or corporations. They have membership fees, they can do fundraisers, and they do get federal and state grants as well. They can be provided at the national, state, and local levels. So some examples of those are the American Cancer Society, Red Cross, Autism Speaks, March of Dimes. They usually focus on one type of thing, like the American Cancer Society or March of Dimes is preemies. Most of these are not ran by volunteers only. A lot of the voluntary and nonprofit agencies are staffed by healthcare workers, and a lot of people don't realize that. They think it's all a volunteer basis, and it's not. They do have employees, and they have paid healthcare workers. So their job is to study the disease, provide funding for research, educate the public on whatever it is, and then provide services to people with those diseases. So if they need help with therapies or medical purchases or treatment centers, they'll help with that as well. I don't know if any of you have ever heard of the Joint Commission. The Joint Commission is something that you deal with a lot in the hospitals. Um, they're a nonprofit U.S. organization created to ensure that the patients receive the safest, highest quality care in any patient setting. So what they do is come into the hospital and they survey the hospitals every few years, usually about every 3, and you become accredited based on how your survey results are. So it doesn't make the survey results public, but it does tell the public whether they have the accreditation or not. So that's pretty much telling you whether they passed or not. A lot of times that they're unannounced. So the Joint Commission can come in at any time. They'll give you like a date period, and they can come in at any time for a surprise visit, and they walk around the entire hospital. So they'll come into diagnostic imaging, ultrasound, x-ray, they'll go into the emergency room, they go into the patient's rooms, surgery, all those places, and what they're doing is they're looking for fails. They're looking to see if you're not meeting the requirements for that safe care. And it can be as simple as having drinks in patient care areas, to like I work in x-ray, and if our lead aprons are touching the ground, that's a fail. I mean, not the whole entire fail, but that's one tick on the box. They're looking for all of those things to make sure that we're meeting the quality of care that the patients deserve. It can be really stressful to deal with the Joint Commission, but when you look at it from a perspective of a patient, it's a really good thing that someone is looking out for all of the hospitals to make sure that the patients are getting the care that they deserve and need. So healthcare plans have become a very big topic in recent past. Um, the cost of healthcare is huge, right? I mean, if you don't have health insurance, it can be detrimental if you have to go in and get care. So it's something that's really important. Healthcare costs keep rising, and they're rising faster than the cost of living. So it's really important for people to have health insurance plans to help pay for that cost. Without insurance, the cost of illnesses or injuries can result in disaster for patients. And a lot of times, patients won't even get care because they know that they can't afford it. Uninsured patients are less likely to get preventative care than patients who have insurance. And they're afraid, when they seek that care, they're faced with these unavoidable medical bills that they know that they won't be able to pay. All right. So imagine that you're riding a bike or whatever, driving your car, whatever you want to imagine, and you get hit. You don't have insurance. You break your femur and need surgery. Now, this cost is ridiculously low because it'd probably be triple that. But say your hospital bill is $25,000 and you can't work for at least 6 weeks because you broke your femur and you can't walk. If you didn't have insurance, or if you didn't have like medical where you could get paid for your time off, imagine where that would put you. Now, hopefully you're blessed and that's not ever going to be an issue for you, but this is a real issue for a lot of people on a daily basis. These people don't have insurance. They're scared of how that they pay their medical bills. So some of them won't even get care. A lot of them, like that, with something like this, obviously they don't have a choice, but it's very rare for people and it's very scary. And a lot of people think, well, if it's, life or death or serious, people will get care. But some people are more concerned about how their family is going to carry on. And, if they can't make the bills and they can't do this. So a lot of times they're going to choose their family over getting care for themselves. So there's a lot of insurance terminology that we use. These are some things that you should know. What's a premium, a deductible, coinsurance, or co-payments? Those are things that you may know from your daily life or past jobs, but these are some things that you should make sure that you're aware of. A premium is the fee that a person pays for their insurance coverage. So the premium is paid to the insurance company. So if you have a job where the job pays your premium, you might not have to pay anything, or you might have to pay a portion of it. So that may come out of your check each week or each month, and it pays for your coverage, or you may have to pay that out of pocket. A deductible is the fee that the patient pays before their policy begins to pay for medical services. So some people might have, say, a $150 deductible to go to the ER. So that deductible has to be paid, and then your insurance will pay for the rest of your ER visit. Coinsurance, that requires that specific percentages of the patient's medical expenses are shared between that patient and their insurance company. So, like, for example, the insurance company may require the patient to pay 25% out of pocket, and then the insurance company will pay the additional 75% of the cost, or on the PowerPoint here it says 80-20. It's just different based on each insurance company. So essentially you're responsible for a certain percentage and the insurance company is responsible for the rest. A copayment, I'm sure you've heard that before. Anytime you go to the doctor, and what's your copayment, or your copayments due today? That is the specific fee paid by the patient for the specific service. So if you're going to a doctor for your normal visit, it might be 20, 25, 30, depends on what it is. Specialists sometimes charge a little bit more. There's a lot of different types of plans out there, and more than even listed here. There's employee-sponsored ones or group ones, which is where the premium's paid by the insurance company, or you as an individual would pay a small percentage of that premium, and it usually comes out of your check. There's HMOs, which provide a managed care plan for the delivery of health care. There's usually a monthly fee or premium that's paid for the HMO membership. HMOs are good in one way because they're directed towards preventative type of healthcare. So individuals are going to have access to early health exams, treatment, and detection of diseases. So that's the good thing. So there is that advantage to an HMO, but one of the main disadvantages to an HMO is an individual is covered by that type of insurance. They're required to only use HMO affiliated healthcare providers. So that means if you've had an insurance in the past and you go to a doctor that you really, really love, if your insurance switches to an HMO, you may not be allowed to go to that doctor anymore. You have to find one that's affiliated with that HMO. PPOs are another type of healthcare coverage. So a PPO is a managed healthcare plan as well. But what the PPO does is it forms contracts with certain healthcare agencies to provide different types of healthcare at a reduced rate. So PPO is essentially saying, like, we'll form a contract with you as an organization, and then we'll send all of our patients to you. So the organization is saying, okay, we'll give you a reduced rate, but we're going to get a lot more people coming in from your plan. So that's the downfall to a PPO is insured individuals are restricted to using specific hospitals, doctors, and dentists. So again, it can be a problem if you've got someone that you really like and they're not a PPO provider. Other types of insurance, Medicare. Medicare is a government insurance program that is for any individuals over the age of 65 or a person who's on disability and receives Social Security for at least 2 years. There's a few different types of Medicare that are important to know. So, Type A Medicare is going to cover your hospital services, any extended care or hospice that you need. Type B is for medical insurance, doctor services, or outpatient. And type D is for pharmaceutical medical expenses. So if you look at it like this, an easy way to help you remember is type A is going to cover the highest cost or most severe, so hospital services extended. B for medical insurance, doctors, and D is pharmaceutical or medication expenses. So I think sometimes that will help to make it a little bit easier. A is for the highest cost, D is for the lower cost. Now, obviously, some medications can be very expensive, but as far as test questions and things like that, I think that helps you remember just a little bit more. Medigap is actually an insurance plan that people on Medicare can pay for, and these are offered by private insurance companies, but they'll cover things that Medicare will not cover. So you're paying a little bit of extra, you pay a premium to have that gap coverage that covers anything that Medicare will not. Medicaid is also federally and state funded. It's operated independently by each state, so there can be different rules and stipulations for Medicaid based on the state that you're in. So benefits for individuals covered can vary from state to state. Medicaid pays for the health care of individuals with low income or children who do not qualify, I'm so sorry, my dog's barking, so it's throwing me off. Children who qualify for public assistance and individuals who are disabled or blind. In some states, the Medicaid also covers dental care, eye care, or other specialized services that they may need. So Medicaid is for any individual Medicaid is for any individual that's on public assistance or children or low income. Medicare is for anyone over 65 or on disability that receives Social Security. Other types of insurance plans are the one is called CHIP. It stands for Children's Health Insurance Program. So what that does is provides health care to uninsured children of working families who might earn too much to qualify for Medicaid, but don't make enough to pay for private insurance. And then there's also workers' comp or workers' compensation, which is a healthcare plan that provides treatment for workers who get injured on the job. What it can also do is reimburse you for the wages that you lost due to that injury if the injury happened while you were on the job. Tricare is a U.S. government plan for military personnel and their families. So Tricare covers all military personnel. Okay, so Tricare provides coverage for all healthcare expenses for families of military personnel, retired members of the military, and active duty members of the military. Managed care plans, those were developed in the response to these rising healthcare costs that I keep talking about. So the principle behind it is that all healthcare provided to a patient has to have a purpose, which is good, right? We don't want to have unnecessary medical tests, procedures, anything like that. So a lot of times with that also means that a second opinion or a verification of diagnosis is needed before care can be provided, which can kind of be a pain. You know, if you need something done and you are forced to get a second opinion, that can take time. So that's the one downfall to it. Every effort is made to provide that preventative care and early diagnosis of disease, which helps avoid the high cost of treating that disease, right? So while I don't like their reasoning behind it is that it's just cost, I like the benefit that the patients get. I mean, obviously, we all want early diagnosis or preventative care, so that good comes along with it. I'm sure all of you have probably heard of HIPAA. HIPAA stands for Health Insurance Portability and Accountability Act. HIPAA was originally passed by Congress in 1996. Its primary purpose was just to help protect employees and their families from losing health insurance coverage after a job change or loss. There's a lot of different things that come with HIPAA. There's 5 different components to it. Um, so the first one is the healthcare access, portability, and renewability. So it limits exclusion on pre-existing conditions to allow for continuance of insurance even with job changes. So prior to this, there was an issue with, sorry, my dog keeps barking. So prior to HIPAA, if a patient had a pre-existing condition, like maybe your child had asthma and you changed jobs, the insurance at your new job could deny you coverage for that pre-existing condition. So when HIPAA passed, that was one of the things that it took out, was the possibility for insurance companies to do that. They prevent healthcare fraud and abuse, so they established a lot of different methods for preventing that, which also reduces the cost and administration of healthcare by using that single set of electronic standards. So using electronic records has helped with fraud, abuse, and the cost. There's also tax-related health provisions. I'm not going to go into those too much. Application and enforcement of group health plans. It establishes standards that require group healthcare plans to offer portability, access, and renewability to all members. And also revenue offsets, which provide changes to the IRS code. So one of the biggest things for you to know is that the Health Insurance Portability and Accountability Act, HIPAA, provides strict guidelines for maintaining confidentiality of healthcare information. And that's one of the biggest things that we're concerned about, is making sure that we're keeping our patients' information safe and secure. We do not want to share that information. It's not our right. And as a patient, you wouldn't want your information shared. So as healthcare workers, it is our job to make sure that we protect the safety of our patients' health information and keep it confidential. So just to kind of go over some scenarios that could violate a patient's HIPAA. One would be just telling your friends or relatives about a patient in a hospital. And sometimes you don't think it's that big of a deal as long as you don't tell the patient the name. But say you said to a friend, oh man, I took care of this patient today and they got shot or they got stabbed, and they maybe know somebody that got shot and stabbed, and you gave them personal information. That's a violation of that patient's right. Or say you were talking about, oh man, I had to take care of this baby today that is suspected abuse, and they've got a broken leg, and they took them away from the parents, and blah blah blah. And then maybe that person knows a friend of theirs had their baby taken away by CPS, but they didn't know why, and now you're giving them that information. So you have to be careful about what you say. You should not be talking about a patient. This is the biggest rule that you could follow. You should never discuss a patient unless it directly relates to the care that they're providing with another healthcare worker. So even if you're talking about it to another healthcare worker, if they're not directly linked to that patient's care as well, you don't need to be telling them that. Another violation of HIPAA would be discussing private health information in public areas of the hospital, like the lobby, elevator, cafeteria. You'd think this would go without saying, but I cannot even begin to tell you how many times I have heard healthcare workers talking about a patient in the elevator. Yes, again, they're not saying their names, but you don't know. They could be discussing something, and I could be a family member that knows what they're talking about. So it needs to be discussed in private areas only when necessary, or even in the cafeteria. Imagine if you're sitting in the cafeteria and one of your loved ones is in the hospital, and you hear healthcare workers sitting at the table next to you talking about your loved one, about maybe something gross that's going on with them, or they're talking about how rude they are, or they're just going to die anyways. So, and I know that sounds cruel, and you think, well, no one's really going to do that, but stuff like that happens. You don't know who's listening to you. Don't discuss anything that does not require the care. Discussing private health information over the phone in a public area is a violation. It's a violation to walk away from your computer and not log off. So if your computer contains any private health information and you get up and walk away and someone else walks up and logs or gets in because you're still logged in and they can view any private health information, that's a violation of the HIPAA laws. And you can actually lose your job for any of these that I've said so far. So, like I said, just always um, only discussing patient information if it relates to their care, always logging off and keeping patient information secure, and making sure that you're giving information to the right patient. A lot of times patients will ask for discs with their images on it. Making sure that the name on the disc matches the name of the patient that you're giving it to. All of those things are very important. If you violate HIPAA, you can lose your job. It is very serious. So that's something that you just need to always remember and keep that in consideration for your healthcare career. When we talk about hospitals and facilities, there's a lot of organizational structure that comes along with that. All healthcare facilities have to have some type of organizational structure. What that means is they have a line of authority or chain of command. It indicates who has areas of responsibility and what they are, and it's essential for the most efficient operation. Structures determined by the size and need of the organization, but essentially what it's telling you is who you would go to in your chain of command. So if you have an issue with something that's going on in your department, it's telling you, go to this person who's directly above you. You should not be going to the CEO of a structure, of an organization, when you haven't went through your chain of command. Now, unless your complaint is about them and you need to bypass them, you should always be going to the next person above you as a first step. And it also helps with giving those areas of responsibility so each individual person knows what's expected out of them and what they should be doing. So in that organizational structure, the lines of authority need to be clearly indicated. Workers must identify and understand their position in the structure. You ever heard that saying, know your role? So that's kind of what it's saying. Make sure you know your role and what is expected out of you, and make sure that you're working within that. You shouldn't be doing things that you aren't supposed to be doing. Now, that doesn't mean, I hate that saying, that's not my job. That's not what that means. That means don't work outside of your range of capabilities. That's not saying if somebody stops you in the hall and asks you a question that doesn't relate to your job that you don't help them or find the answer to their question. So as a worker, you need to take your problems, reports, or any questions to your immediate supervisor. And then if that's not met, then there's a chain of command that you can go to from there on. So the summary for Chapter 2 is healthcare is one of the largest and fastest growing industries in the U.S. There's a lot of different types of facilities that can provide healthcare related services. All healthcare facilities are going to require different healthcare workers at all levels of training, and they're all vital and important to each institution. No one is any more important. What I've really liked about COVID right now is giving credit to different healthcare workers that deserve it. I read something the other day about how environmental services or housekeepers were the real heroes. I mean, can you imagine right now where we would be if we didn't have those people that were going in and cleaning those rooms to make sure that they're safe for the next person? Or the hospital in general, the general areas, where people are sitting and doing things. So in healthcare, there is not one person who's more important than the other. A doctor is not more important than an LPN. An LPN is not more important than a healthcare worker or than a housekeeper or a dietary aide. We need all of those individuals to help that facility function properly to give our patients the best care possible. So I'll get off my little rant there, but it is something that's always been very important to me. Also, as a summary, just know that there's many different types of healthcare insurance plans out there that can help cover the cost of healthcare. And always know that organizational structure is very important for all healthcare facilities. And that's it.